Hi, my name is Morgan Duvall. I'm a physical therapist, and today I'm going to talk to you a little bit about sciatica. Now, sciatica is a general term that most folks use when they're referencing low back pain that possibly refers into the glute and maybe even down the leg. Sciatica is actually compression of the sciatic nerve, but it can happen in several different ways, and it's very important that you understand how your sciatica is originating so that you can treat it effectively. Treatment for one type of sciatica may actually make a different type of sciatica worse. There are three main ways the sciatic nerve is compressed, but in order to understand these ways of compression, you really need to understand what the sciatic nerve is. The sciatic nerve originates in your lumbar spine. It's basically a bundle of several different nerve roots that exit at the L4, L5, S1, S2, and S3 vertebra. Those nerve roots come together to form a big sciatic nerve, which runs down through your glute and passes under a muscle deep in your glute called the piriformis. Sometimes, depending on your anatomy, it may even pass through the piriformis, and then goes all the way down the back of your leg. So the sciatic nerve can be compressed at the lumbar spine or at the piriformis muscle, and it gets even a little bit more complex than that. The sciatic nerve can be compressed in different ways at the lumbar spine, so we'll talk about those ways one at a time. The first way that the sciatic nerve can be compressed is actually due to what's called spinal stenosis. This is narrowing of the spaces between your vertebra joints in your lumbar spine. This happens with age and joint degeneration, and when this happens, the lumbar vertebrae actually come together and they compress those little nerve roots that exit out in between the lumbar vertebra and which later come together to form the sciatic nerve. The second way the sciatic nerve can be compressed is through a disc issue, right? A disc bulge or a disc rupture. If one of the discs in between your lumbar vertebra starts to move posteriorly backwards, it too can come into contact with the nerve roots that come together later on to create the sciatic nerve and cause compression to those nerve roots, which can translate down and become sciatica. The third way that the sciatic nerve can be compressed is actually lower down in the glute at the piriformis muscle. So that sciatic nerve, remember I said it passes underneath, possibly through your piriformis muscle. If the piriformis muscle is very, very tight and very, very restricted, it can be so tight at that spot that it compresses the sciatic nerve. So depending on how your sciatic nerve is compressed, you may do different exercises in order to relieve that compression. For example, if your sciatic nerve is compressed at the lumbar nerve roots because of spinal stenosis, remember narrowing of the joint spaces, what you'll want to do is open up those spaces. So spinal traction or possibly even spinal flexion can feel very good to decompress the nerve roots in that case. However, if your sciatica is caused by a disc rupture or a disc bulge, you actually want the opposite treatment. You'll want spinal extension to push that disc, which is moved posteriorly, remember, out backwards. You want to push it back into its spot via spinal extension. Okay, so two very different treatments for a presentation, which may actually seem similar to the layperson. Lastly, the piriformis, if your sciatic nerve is compressed at the piriformis, what you need to do is stretch the piriformis muscle and improve your hip mobility to decompress the sciatic nerve lower down in your glutes. So I'm going to talk about several different exercises that you can try to treat your own sciatica. However, I always recommend that you seek evaluation by a licensed physical therapist so that they can help you determine which type of sciatica you may be experiencing. So the first exercise that I'm going to show you is called single knee to chest. And this exercise is basically for sciatica originating from spinal stenosis because it's going to move your spine into flexion. Remember, that's going to open up the spaces between your vertebra and decompress spinal nerve roots, which are being compressed via spinal stenosis. So for the single knee to chest exercise, you will lie down flat on your back. And then the leg that's experiencing the symptoms, what I want you to do is pull that leg into your chest. You can interlace your hands behind or in front of your knee, whatever feels more comfortable to you. Gently pull that leg as close to your chest as you can, and you should feel some symptom relief here. If you ever feel your symptoms going down your leg, getting worse in the leg and not moving up towards your spine, that's actually a concept called peripheralization. It is not what you want. The lower down in your leg your symptoms are, the worse you're irritating your nerve or your nerve root. So if your symptoms are going down your leg, that's peripheralization. You do not want that. Come out of the exercise. If your symptoms actually seem as though they're creeping up towards your spine and they're getting closer to the spine, that's called centralization, and that's good. That means that you are actually decreasing the irritation on the nerve root. So keep those concepts in mind as you try these exercises, and be sure that you are noting whether you are peripheralizing, going down the leg, or centralizing symptoms coming up the leg. Centralizing good, peripheralizing bad. Okay, the second exercise I want to show you is also good for sciatica caused by spinal stenosis, and will also be good for sciatica caused by piriformis compression on this. So this is a twofer, this is a double whammy. You'll start the same way as you started for the single knee to chest. Lie down flat on your back, interlace your hands behind or in front of your knee. Then you'll gently pull your leg across your body, and you should feel a gentle stretch on the outside of your glute in your piriformis muscle. So because your knee is in your chest, you are facilitating a little bit of spinal flexion, which is good to decompress nerve roots that may be compressed by a spinal stenosis. And at the same time, you're stretching your piriformis, which is good to decompress the sciatic nerve if it is compressed lower down at the glutes. So this is a twofer. This is good for both spinal stenosis and piriformis. The next exercise I'm going to show you is good also for sciatica caused by spinal stenosis or piriformis compression. Once again, you'll lie down flat on your back. This is called the figure 4 stretch. You may have seen it before. Lie down flat on your back, bend your knees, place the soles of your feet onto the surface on which you are lying. Take your symptomatic leg, place that ankle on top of your non-symptomatic leg's knee. If this is enough for you, you can stay right here. If you already feel a big stretch, no need to go further. If you would like a little bit more of a stretch, you can interlace your hands behind or in front of your knee, the non-symptomatic leg knee, and gently pull the figure 4 that you've just created in towards your body. You should feel more of a stretch through your symptomatic legs, piriformis, or outer glutes. For even more of a stretch, you can take your hand and gently press your knee open. That's your symptomatic knee. And you should feel an even deeper stretch into your piriformis. Okay, so we talked about a few exercises which are good for sciatica caused by either spinal stenosis or piriformis compression. Let's talk about exercises that will be good for sciatica caused by disc ruptures or disc bulges, and these are actually quite a bit different. So for any sciatica caused by a disc rupture or a disc bulge, remember you want spinal extension so that you can push that bulging disc back into its place. So what you'll do is you'll lie down on your stomach. This may already be pretty intense. So if you already feel as though, whoa, this is intense, I don't want any more, that's totally fine. Just interlace your fingers together, place your forehead on top of your fingers, and just lie here gently and comfortably, allowing yourself to settle into the position. If you feel okay and you feel as though you could tolerate a little bit more, try to squeeze your glutes, right? That's it. Just squeeze your glutes, hold for a couple seconds and relax. That should facilitate just a little bit more spinal extension, which should help with your sciatic symptoms related to a disc bulge. If this has become easy and you'd like to up level a little bit more, the next step is to come up onto your forearms. This is going to bring you into even more spinal extension, being mindful, of course, of your peripheralization and centralization. Remember, you want centralization, you do not want peripheralization. So be mindful of those symptoms. And if you feel as though your symptoms are starting to go down your leg to peripheralize, then you want to come back out of the forearm position all the way back down onto your palms. If you feel okay in your forearm position to intensify, you can try bending one knee, maybe the other, and that's going to bring you into even deeper spinal extension. The final advancement for this exercise is to come all the way up onto your palms. This is going to bring you into maximum spinal extension. Once again, keep an eye on those symptoms, right? You want centralization. If you feel that happening, you're in a good spot. Possibly try to bend one knee and the other to maximize spinal extension potential, always being mindful of your symptoms. None of these exercises should hurt. They should all give you relief. So if at any point they are hurting, back off, go to the level below, and stay at that level until you can tolerate moving up without symptom exacerbation. Okay, thank you so very much for watching my video. I hope you learned a little bit of something. Have a wonderful day. Get out there, be healthy, be well.